there. Welcome to today's video where I'm going to show you how to fix your posture in just 60 seconds without any equipment. Before we dive in, I'd love to know where you're watching from. Drop it in the comments below. And if you're serious about improving your health through simple, effective techniques like what I'm about to show you, hit that like button and subscribe to the channel for weekly content that can dramatically improve your well-being. We're facing a posture pandemic these days. Look around you. At coffee shops, in offices, on public transport, everyone's hunched over their devices. The average person spends over 10 hours a day in this forward head posture, creating what I call tech neck. This constant forward bend puts tremendous strain on your spine. With every inch your head moves forward, adding about 10 pounds of pressure on your neck and upper back. Poor posture isn't just a cosmetic issue. It directly impacts your breathing capacity, can cause headaches, contributes to muscle imbalances, and even affects your mood and energy levels. Studies have shown that proper posture can instantly increase testosterone and decrease cortisol levels, literally changing your biochemistry for the better. Today's technique is something I've refined over 30+ years of working with patients. It's deceptively simple but remarkably effective. Unlike most posture advice that only addresses symptoms, we're going to correct the underlying structural issues in just 60 seconds. This isn't about forcing yourself to sit up straight, a command that rarely works long-term. Instead, we'll target the key muscle groups that naturally maintain proper alignment, ready to transform your posture and experience immediate relief. Let's get started with a technique so effective you'll feel the difference before this video even ends. Before we jump into the 60-second fix, let's quickly understand what's happening in your body when posture deteriorates. This knowledge will help you maintain your improvements long-term. Your spine naturally has 3 curves: cervical, neck, thoracic, mid-back, and lumbar, lower back. These curves work together to distribute force and maintain balance. When you sit hunched for hours, these curves start to reverse. The head moves forward, the shoulders round, and the upper back curves excessively, creating a domino effect throughout your entire skeletal system. The key postural muscles, including your deep neck flexors, lower trapezius, and core stabilizers, become weak and inhibited through lack of use. Meanwhile, other muscles like your upper trapezius, pectorals, and hip flexors become chronically tight and shortened. This muscle imbalance creates a self-reinforcing cycle that makes poor posture feel normal to your body over time. Here's what's fascinating. Your brain prioritizes efficiency over optimal alignment. After years of poor posture, your proprioceptors, position sensors in your joints and muscles, recalibrate to this new normal. That's why simply trying to stand up straight feels uncomfortable and unnatural at first. What's more concerning is how this affects your internal health. Compressed. Lungs reduce oxygen intake by up to 30%. The vagus nerve, which runs through your neck and controls your parasympathetic nervous system, becomes compressed, potentially contributing to digestive issues, increased stress, and reduced recovery capacity. Even more alarming is recent research showing that forward head posture can reduce lung capacity by up to 30%, potentially shaving years off your life. Each inch your head moves forward can add 10 pounds of pressure on your cervical spine, leading to premature disc degeneration. The good news: your body has an incredible ability to recover and reset, even after years of poor habits. The technique I'm about to show you works by rapidly resetting your proprioceptive system and activating the exact muscle groups needed for optimal alignment. Now, for the moment you've been waiting for, let's go through the 60-second posture reset technique. Follow along with me right now. Whether you're sitting or standing, you'll feel the difference immediately. Step 1, 15 seconds. Start by sitting at the edge of your chair or standing with your feet shoulder-width apart. Take a deep breath and raise your arms overhead as high as you comfortably can, keeping your elbows straight. Hold this position while taking 3 deep breaths. This initial move decompresses your spine and activates your serratus anterior muscle, which plays a crucial role in shoulder blade positioning. Step 2, 15 to 30 seconds. Keeping your arms raised, pull your shoulder blades down and back, as if you're trying to put them in your back pockets. Now rotate your palms to face forward. This activates your lower trapezius and rhomboids, the key postural muscles that become weak with prolonged sitting. Hold this position for 5 seconds while breathing normally. Step 3, 30-45 seconds. Slowly lower your arms to shoulder height with palms still facing forward. Create a slight tension, as if you're pulling apart an imaginary resistance band. While maintaining this position, tuck your chin slightly, not looking down, but creating a double chin sensation. This specifically targets your deep cervical flexors, the muscles that prevent forward head posture. Step 4, 45-60 seconds. Maintaining the shoulder and neck position, place your hands on your abdomen and brace your core as if preparing for someone to push you. Simultaneously, squeeze your glutes at about 20% of maximum effort. This activates your core stabilizers and posterior chain, creating a full-body postural reset. Hold this final position for 15 seconds while taking deep breaths into your diaphragm, expanding your ribcage in all directions. This 60-second sequence works by neurologically resetting your proprioceptive system and simultaneously activating all the major postural muscles in the correct sequence. It's like hitting the Restore Factory Settings button on your posture. The key is performing this with focus and precision rather than rushing through it. I recommend doing this reset at least 3 times daily, morning, midday, and evening, plus any time you catch yourself slumping. Within 2 weeks of consistent practice, you'll notice these proper positions beginning to feel more natural as your body recalibrates. Now that you've learned the 60-second reset, let's address the most common posture mistakes I see in my practice and how to avoid them throughout your day. These insights will help maintain your improved posture between reset sessions. First mistake, the smartphone slump. The average person checks their phone 96 times daily, each time dropping their head forward and compromising their neck position. Instead, try this. Raise your device to eye level rather than bringing your head down to it. Place a pillow on your lap when sitting to elevate your phone, or use a standing desk setup that keeps screens at eye level. Second mistake, the keyboard hunch. Most people reach forward for their keyboard, causing rounded shoulders and a collapsed chest. The fix, pull your keyboard closer to your body. Keep elbows at approximately 90 degrees and maintain that shoulder blade retraction we practiced in the reset. Third mistake, the driving slouch. Long commutes destroy posture for millions daily. Solution, adjust your car seat to maintain a slight arch in your lower back. Position the steering wheel to keep shoulders relaxed and use your headrest properly by keeping the back of your head lightly touching it throughout your drive. Fourth mistake, the sleep collapse. Many unknowingly reinforce poor posture during sleep. If you're a side sleeper, place a pillow between your knees and ensure your pillow keeps your neck aligned with your spine. Back sleepers should avoid overly thick pillows that push the head forward. Fifth mistake, the standing sag. Many people lock their knees and push their pelvis forward when standing, creating excessive arch in the lower back. Instead, keep knees slightly soft, engage your core at about 20% effort, and distribute weight evenly between the front and back of your feet. The most dangerous mistake of all, inconsistent awareness. Most people only think about posture when they're in pain. The solution is to create environmental triggers that remind you to check your posture. Place colored stickers on your devices, set hourly reminders, or use the act of walking through doorways as a trigger to perform a quick posture check. Remember, perfect posture isn't about rigid military-style positioning. True, good posture should feel effortless and natural, allowing for movement and dynamic stability rather than static holding patterns. You might be surprised to learn that the benefits of good posture extend far beyond preventing back pain. Let me share some research-backed benefits that most people never associate with posture improvement. First, cognitive function and mood. A fascinating study from Harvard showed that participants who sat in powerful, upright postures experienced a 20% increase in testosterone and a 25% decrease in cortisol, the stress hormone. They also demonstrated improved executive function and decision-making capabilities. Simply put, your physical posture directly impacts your mental clarity and emotional state. Second, respiratory efficiency. When you slouch, you compress your diaphragm and lungs, reducing oxygen intake by up to 30%. Our 60-second reset immediately increases lung capacity, allowing for better oxygenation of tissues and improved energy production at the cellular level. Many of my patients report reduced afternoon fatigue simply from maintaining better posture throughout the day. Third, digestive health. Poor posture creates compression in your abdominal cavity, potentially contributing to issues like acid reflux, constipation, and sluggish digestion. The postural reset we practiced helps create optimal space for your digestive organs to function properly. One study found that participants with chronic digestive issues experienced significant symptom reduction after 8 weeks of posture correction. Fourth, confidence and social perception. Research consistently shows that people with upright posture are perceived as more confident, competent, and trustworthy in social and professional settings. One study found that job candidates with better posture were 40% more likely to be selected for positions, all other factors being equal. Fifth, athletic performance. Proper alignment optimizes force production and transfer throughout your kinetic chain. Athletes who correct postural imbalances often experience immediate improvements in strength, power, and coordination. The 60-second reset is particularly valuable before workouts to ensure you're training with optimal biomechanics. Perhaps most surprising is the impact on longevity. A 20-year longitudinal study found that excessive thoracic kyphosis, rounded upper back, was a significant predictor of increased mortality, independent of other health factors. The researchers concluded that spinal alignment directly affects vital organ function and overall health span. These benefits aren't just anecdotal. They're backed by peer-reviewed research showing that something as simple as how you hold your body can fundamentally change your biochemistry, psychology, and long-term health outcomes. While our 60-second reset is remarkably effective on its own, adding these targeted supplementary exercises will accelerate your results and make good posture your new default. Each exercise specifically addresses a key component of the postural system. First, the wall angel. Stand with your back against a wall, feet about 6 inches from the baseboard. Keep your lower back flat against the wall, not arched. Place your arms against the wall in a goalpost position, then slide them up and down while maintaining contact between your wrists, elbows, and the wall. This is challenging for most people initially, but extremely effective at countering rounded shoulders. Aim for 10 slow repetitions daily. Second, the chin tuck. While sitting or standing, place 2 fingers on your chin and gently push it straight back horizontally, not down, creating that slight double chin. Hold for 5 seconds and release. This specifically strengthens the deep neck flexors that prevent forward head posture. Perform 10 repetitions, 3 times daily. Third, the doorway stretch. Stand in a doorway with your arms raised to shoulder height. Elbows bent at 90 degrees and forearms resting on the doorframe. Gently lean forward until you feel a stretch across your chest and hold for 30 seconds. This counteracts the chest tightness that pulls shoulders forward. Do this 2-3 times daily. Fourth, the prone YTW. Lie face down with arms extended overhead in a Y position, then move to a T position, arms straight out to sides, then to a W, elbows bent at 90 degrees, squeezing shoulder blades. Hold each position for 5 seconds while keeping your neck neutral. This strengthens the entire posterior chain responsible for upright posture. Fifth, foundation breathing. Lie on your back with knees bent and feet flat. Place one hand on your chest and one on your abdomen. Practice breathing so that your abdomen rises first, followed by your lower ribs expanding sideways while your chest remains relatively still. This diaphragmatic breathing pattern supports proper core activation and spinal positioning. For those with more significant posture issues, I recommend adding gentle thoracic mobility work. Foam rolling your upper back for 2 to 3 minutes daily can dramatically improve thoracic extension, making it easier to maintain an upright posture. Remember, these exercises aren't about building massive strength. They're about neurological repatterning and creating balanced muscle tone. Consistency trumps intensity here. A daily 5-minute routine incorporating these moves will yield better results than an occasional hour-long session. Track your progress by taking side view photos monthly or measuring the distance from your ear to your shoulder when standing naturally. You'll be amazed at how quickly your body responds to these targeted interventions. Let's wrap everything up with a practical 30-day plan to revolutionize your posture and transform how you feel in your body. I've seen thousands of patients implement this exact protocol with remarkable results. Week 1, focus on awareness and the 60-second reset. Perform the reset first thing in the morning, midday, and before bed. Additionally, set hourly reminders during your workday to check and correct your posture. Take before photos from the side and front to track your progress. Week 2, maintain the resets while adding the supplementary exercises from Chapter 6. Start with just 5 minutes daily, focusing on quality rather than quantity. Begin implementing the environmental modifications we discussed, raising screens to eye level, adjusting your driving position, and optimizing your sleep setup. Week 3. This is when most people experience a neurological shift. Proper posture starts feeling more natural than the old patterns. Continue all previous practices while adding one posture mindfulness walk daily. For 5 to 10 minutes, walk with exaggerated good posture, focusing intensely on the sensation of optimal alignment. Week 4. Fine-tune and personalize your approach. By now, you'll have identified your specific challenge areas. Some people struggle most with forward head posture, others with rounded shoulders. Emphasize the exercises that address your particular weaknesses. Take new photos and compare them to your starting point. The visual evidence will be motivating. For long-term success, remember these final crucial tips. Movement is medicine. Even perfect posture becomes problematic when held statically. For too long, aim to change positions at least every 30 minutes. Brief movement breaks reset your muscular system and prevent adaptive shortening. Environment shapes behavior. Your physical surroundings powerfully influence your posture. Invest in simple modifications like monitor stands, lumbar supports, or a standing desk converter if possible. Make your environment work for your posture, not against it. Identity is stronger than willpower. Start seeing yourself as someone who values and maintains good posture. This identity-based approach creates lasting change more effectively than relying on constant conscious correction. If you've experienced chronic pain or severe postural deviations for years, consider consulting a physical therapist or chiropractor. For a personalized assessment, the 60-second reset works for most people, but some may need additional specific interventions. Remember, posture isn't just about how you look, it's about how you function and feel. The benefits extend to virtually every aspect of your health. The small daily investments you make in your posture will pay dividends in energy, confidence, and well-being for decades to come. If you found this video helpful, please hit that like button and share it with someone who could benefit from this information. Don't forget to subscribe for more content on optimizing your health through simple, effective strategies. Let me know in the comments which tip you found most valuable and what posture topics you'd like me to cover next.